after you take step 1, you're ready to go over to the hospital, and you'll spend much of your time in the hospital because you'll be doing those core specialties. You'll be doing psychiatry, family medicine, obstetrics and gynecology, pediatrics, surgery, and internal medicine. The order you do it depends on your school, depends on if you have a deadline for step 1, but those are the core specialties that you'll be rotating through during your 3rd year, and it's important to do well in those. A lot of the evaluations are subjective. Of course, there's an exam after each rotation, but a lot of the evaluation is subjective. It's based on how hard you work, how well you perform as a team, knowledge base, and just how professional you are. A big part of our grade at our school was professionalism. It was less about your knowledge base, because if you pass step 1, they realize that you have at least a baseline knowledge, so you're coming in with that knowledge, so they're not really concerned about that. Of course, you're learning new things, but you're applying what you learned in the first 2 years to your clinicals. But again, it's very subjective. You want to make a good impression on the attendings or the faculty physicians, and just work very hard on those rotations. So that's 3rd year. And then 4th year, that's where you can do away rotation. So you've picked which specialty you want to go into, and then 4th year is about securing that spot, going on interviews, doing away rotations to get more exposure to the field and to possibly get letters of recommendation. I'll do a separate video on the matching process because that'll be too long. But the 4th year is where you are really trying to secure a job for after you graduate. So you might be taking some electives, you may do some away rotations, you may, I think every program has to do some sort of internal medicine ICU rotation. And then in terms of the electives, you can, at our school, we were able to pick what we wanted. So I did some more research. I was a TA for an anatomy course. I did a month of pathology. What else? I can't remember, but there was another elective. And then I did some pediatrics, some more OBGYN. But 4th year was really flexible, and when I was interviewing, that was a chance for me to see where I would fit at a program, and I'll talk about that in another video. But 4th year, you really, once you've gone through all the interviews, it's like a waiting process until the 3rd week in March, where you find out where you matched and where you'll be going after graduation. And hopefully you have some time to relax before residency starts and graduate. So all that hard work will pay off and you'll graduate, and then you'll have a job, fingers crossed, by the end of the 4 years. So that's all I have in terms of summarizing the 4 years of medical school. But of course, if you have any questions, just leave them below and I'll get back to you as soon as I can. It's a little busy now, but I do read as many of the comments as I can and respond. And also you can send me an email if you have a more personal question regarding the medical school process. And also, if you are in medical school, if you're having any issues, just leave me an email and I'll get back to you. So I hope you enjoyed this video. Stay tuned for the next one. I don't know what I'll be talking about. Maybe the step exams, step 1 and step 2, maybe the residency application process, because I know that's right around the corner in September. But if you have any ideas or suggestions of videos that you want, just leave them below. And if you're not following me on Instagram, I have one for the hair, of course, down to a T, but I also have one that's more personal and more about the medical aspect, and it's called Dr. Tosin, Drtosin. So you can check that out if you want to. All right, talk to you later, and I'll see you in the next video. Bye.